Hi, my name is Tracy Podolsky, and I'm a physical therapist and certified lymphedema therapist for the past 20 years. I have had my own private practice for the past 16 years delivering conventional physical therapy. So what is conventional physical therapy? Well, in terms of lymphedema, it is called complete decongestive therapy. And this therapy is so highly effective. I love treating patients and seeing the reversal of the swelling and then teaching people how to manage it lifelong. However, over the last 4 to 5 years, I've been introduced to functional medicine. So when I think about myself as a functional physical therapist, this is where I don't only look at the symptom, which is swelling. I look at the triggers and maybe even the root causes of lymphedema or other different types of swelling disorders. And so we look at the foundational principles of health, including nutrition, stress management, sleep, toxic load, and relationships. And we put all of those things together, as well as looking at your exercise and activity level. And those things, when put into balance, can help further improve your management of lymphedema, and for some people, even reverse it. So when we look at the root causes of why people develop lymphedema after, let's say, a cancer surgery, we're not looking at that person's lifestyle. We're just looking at the things that we can do to treat the symptom. So in the lymphedema world, I always like to look at the first step is treating the swelling first, because when you have lymphedema, there's all sorts of things that are happening on an inflammatory level, as well as scar tissue laying down. And if you've had it long enough, adipose tissue or fat cells can even lie down in the limb or the area where you have swelling. So the first step, if you have never had lymphedema treatment before, is to get the swelling under control. And that's with complete decongestive therapy. And there's an intensive phase and a self-care management phase. The intensive phase is intensive. It's where you create a partnership with your lymphedema therapist, and they will deliver the manual therapy, which includes manual lymph drainage and compression bandaging and skin care. And when you reduce to your most maximal reduction, you get fit for some form of self-care management regimen, which typically includes compression garments, and as well as skincare education and follow-ups. And that's typically what a conventional self-care regimen and follow-up schedule has consisted of for the first 16 years of my practice. Since I discovered functional medicine, however, there have been many patients over the last 4 to 5 years who have changed those root lifestyle behaviors and have made such an impact on not only their lymphedema, but their overall health. And this really sparked my interest so much that I've gone back to school, and I am going through the Institute for Functional Medicine in order to assist you in not only helping get the swelling under control, but also to reduce any triggers or even root causes of why you even have the swelling. So depending on where you're at in your diagnosis and whether or not you have goals to further improve the health of your lymphatic system and how it interacts with all of the other organs and tissues and cells of the body, you may choose to go down the functional medicine path. And that is going to dig deeper into different things like your genetics, as well as different areas of your lifestyle that fall into the category of what you are eating, how you're managing your stress on a daily basis, what toxins might be in your environment that are causing or triggering some of your symptoms. So many things that we can do that are within our control that are not part of our typical conventional therapy. Now, conventional therapy is super important. So we know that at the bare minimum, we need to get your swelling under control. And if you don't choose to go down this functional medicine path, if it's not the right time for you, there's always follow-up in terms of making sure that your swelling remains under control, and making sure you replace your compression garments. So I welcome you to reach out with the form that is on this website, and I welcome you to become part of my Wyatt Rehab family. I look forward to meeting you and working with you in the future.